And now on the line is Breda Gahan from Concern. Breda, welcome to the programme.
Thank you, Darren. Thanks for inviting us to speak on Near FM again, me on behalf of Concern Worldwide.
Okay, Breda, I've done many interviews with you over the last few years about the fight to try to end HIV and AIDS. And today is our first time doing an interview that is not about that fight, but about another big public health matter, TB. Breda, can you tell us what your personal and professional experience is to date in the fight, in the battle to try to end TB?
Well, yeah, I guess I'm a nurse midwife, so I first came across TB when I was training as a young nurse in the Mater Hospital. But there wasn't huge numbers at that time, but I was certainly aware and the history of TB in Ireland when there was a lot of fear and stigma and discrimination, and people were in sanatoriums for long periods. I guess in my overseas work, where I became aware of it most was when I started in Cambodia, as the war was ending at the end of 1990. With the collapse of the health system, years of regime under Pol Pot, the health system was barely functioning and people were malnourished, and exposure to TB was rampant in the parts of the country where I was based, Compostboo. And I think I have never seen so much TB in any country since that time. So many people were coughing up blood. You would see people almost with the same symptoms as HIV today if people are not accessing treatment, in terms of weight loss, depression. Coughing up blood was the big factor, and people were afraid of it. And we had great difficulty supporting people and convincing them that A, TB is preventable, generally, with BCG vaccine, and also it's increasingly treatable and curable, unlike HIV, which is still not curable.
You mentioned there coughing up blood. Can you tell us more about the illness itself? Like, what does it mean to have the illness and what the symptoms are? You mentioned depression as well. Go on, yeah.
That's right, Darren, yeah. Well, it's caused by a bacteria. It's spread by airborne, so if people cough it out, but you need to be exposed to a lot of airborne infection to contract TB. But people are, I guess, worried when they know it's airborne in terms of travelling on airplanes and all that. And the symptoms generally are, like I said, joint pains, weakness, weight loss, fever, night sweats, and coughing up blood is the one, obviously, that, is fearful for a lot of people because they might think they had cancer or something. And because of stigma and discrimination and fear, many people delay going for treatment. But it really is important to support people to understand that treatment can be very successful and can cure TB. And a person needs to inhale a lot of bacteria germs close to a person who has TB to contract TB. But then again, it did run in families, like I saw in Cambodia, apparently in Ireland in the past, in the much of the 20th century. The main drivers continue to be poverty, often where there can be homelessness, drug or alcohol misuse, person is a migrant or a refugee, where really a person cannot maintain their positive health status. And food, or good food, is a huge contributing factor in terms of treatment for HIV. Like I said, TB and HIV, food is the first medicine also with TB. So it really is important that people are diagnosed if they detect any symptoms that they might think, oh gosh, it's a cancer or it's HIV. It could be TB, which is very curable. And even in 2017, it's interesting that, obviously hot, humid climates seem to support transmission, because the 8 countries most affected still are India, China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, where I'm travelling to next week, and South Africa. But again, it would be among the poorer populations in these countries that are most exposed due to poor housing and poor food conditions in their situations. Like the people concerned works in Bangladesh, in the urban areas are slum dwellers, squatters and pavement dwellers, people who live, grow up and die on the streets. So you can imagine their exposure to disease and infection, especially during the rainy season or during the very hot, dry season. And many of them would not have the information or the access to the health services to be able to get tested and then get on the treatment that's required.
You mentioned there a couple of times there's a big social stigma with the illness in developing countries. It's kind of comparable to AIDS, is it, in that sense, is it?
Well, yes, a little bit, and not, I guess, not unfounded that TB is actually the leading killer of HIV-positive people. If HIV is not treated and if TB is not treated, it's the major opportunistic infection. And of the 10 million people who developed TB in 2017, almost 200,000 of those were people already infected with HIV because it affects the immune system. And a strong immune system can help people withstand contracting TB. Also, BCG vaccination is important, and in many poor countries, maybe, especially in countries where there's conflict, like at the minute in South Sudan, where Concern has great difficulty supporting the outreach health programs due to insecurity. Again, children and later adults are more likely to be exposed to TB. But the stigma is also associated with different myths and misconceptions. Some people think it's witchcraft, it's bad on a family, because obviously people in close proximity can develop TB, so then a whole family can become infected. And not unlike the way poorest families in Ireland were isolated and put into sanatoriums during the big TB outbreak in Ireland after the famine and during much of the 20th century. It's still, the same drivers are still driving TB infection.
It really was a huge issue in Ireland, wasn't it?
Absolutely. I believe that thousands of people were dying at one stage. I read that in the 1940s, more than 4,000 people a year were dying from TB-related disease, and the stigma was a big issue. People were shunned. People would not go to visit people in their houses with TB. I was reading about a great doctor, Dorothy Stopford Price, who started working on people who are living with HIV to help them to be able to get better treatment
TB
TB treatment in sanatoriums. And great action had to be taken by the Red Cross and others to support people, and even to support health workers who were afraid themselves of contracting TB. And I saw the same in Cambodia when I was there. We really had to work with health workers and help them to protect themselves before they would agree to work with people living with TB, especially if they were coughing up bloodstained sputum, to put it crudely. And that's how people were found out. It was almost a bit like leprosy in some of the Asian countries, which again, a bit like Ireland in the past, education is critical, and supporting outreach programs to be able to reach people to understand that BCG is not totally effective, but it certainly boosts the immune system to be able to withstand TB bacteria infection. I mean, even today, homeless people in Ireland are probably the people most exposed, especially in the winter season now upon us. And there's always been stigma with extreme poverty in Ireland, Asia or Africa, because these are the people who are most likely to get TB, HIV and other infectious diseases. So people tend to stay away.
I think it was Dr. Noel Brown, the Minister for Health, I think he was around the 40s, that kind of turned the tide against TB in Ireland. I think it was him, wasn't it?
Yes, he was one of the leading activists as well to support in getting better treatment, better conditions, and supporting children who were out of school for long periods to be able to recover and get back to school. People were even afraid when people came back to school or back home that they might not be totally cured. And these days, I mean, there is an issue with multi-drug resistant TB infection. So it's important that people get diagnosed and tested even earlier. Concerns program in India in the past was supporting the Ministry of Health workers to track loss to follow up people who were dropping out of treatment. Because even the short course treatment, it's over 6 months. So, it takes time.
You were saying there that there are I think there's 8 countries that TB is still a big problem in. Do you concerned working in any of these countries? India, is it? And any other countries?
Well, up until recently, we were working in India. We work in Pakistan. We work Bangladesh. I'm going there next week. And like I said, it's a big problem, particularly in the Asian countries. And South Africa, it really is related to TB, to HIV.
And it actually... go on, yeah.
Well, the data says that when among the 10 million people living with TB disease, 1.2 million of those people are also living with HIV. That's why South Africa is dually infected and affected with TB and HIV. One goes with the other because it really does attack the immune system, HIV, and likewise TB, as people get very ill, they don't eat very well, they're sick, and their immune system weakens.
And I read the other day that more people actually die of TB every year than die of AIDS and malaria. That's unreal, isn't it?
Yes, TB is now one of the top 10 causes of death worldwide.
Okay.
Children became ill with TB. So it is still a problem in countries where vaccination is not able to be provided due to conflict, like in parts of Nigeria, South Sudan, Central African Republic, where concern is working, Eastern Democratic Republic of Congo, where there's also an Ebola outbreak at the minute. So again, the big barriers are certainly lack of security, governance, conflict, and poverty, along with the stigma and discrimination, continue to facilitate the spread of HIV and TB. And as long as TB is existing, HIV will continue because people living with TB are more likely to be exposed to contracting HIV, and a vicious circle ensues.
You mentioned there the vaccine. Breda, what is it going to take overall to end TB?
Well, ending the TB epidemic is one of the sustainable goals by 2030. So literally it starts with education for prevention, prevention through vaccination, prevention through social investment like dealing with homelessness, extreme poverty, improved livelihoods for extremely poor people, vaccination outreach to urban slum poor areas, the rural poor in remote areas in Africa and Asia. Education is the best defense in terms of combating the myths and misinformation and the stigma and discrimination. Myth busting, as some people would call it. Those affected and those living and those who recovered from TB are probably the best people to educate others, TB survivors. People who have come through TB, maybe are weakened but are living successfully now with TB, both in Ireland and in developing countries. These are probably the best people to educate others, and for people who have been affected by TB. But it has to begin with education, so that people understand how it's caused, how it's not caused, and how people can protect themselves. And the World Health Organization, with UNICEF and other actors working with Concern, with ministers of health in the countries where Concern is working leading, it is possible to end AIDS by 2030 if the investment is put in place.
TB and AIDS.
TB and AIDS. Yeah. And the outreach health workers need to be paid. Safe vaccination needs to be delivered, but it needs to be invested in. Like financing is very important, and most children are vaccinated against the 6 main diseases at childbirth, and TB is included there in terms of BCG.
Is that in Ireland as well? When kids are born, they get a vaccination against TB, is it?
Usually before, yes. I trained in the Coombe Hospital here in Dublin, so usually children will get their BCG before they leave the hospital or in the first couple of weeks of life.
All right. I find it
isn't 100% efficacious in terms of a vaccine, but it certainly boosts the immune system to protect the child from contracting TB.
I find it incredible that there is actually a vaccine to stop TB. It's just a question of particularly finance and outreach to get everyone in the world to make sure they have a vaccine. And if everyone did have a vaccine, the rate of TB would totally decrease hugely, wouldn't it?
Absolutely. It's education. For young mothers in antenatal care, it needs to be included that the 6 childhood vaccines are critically important to prevent infectious diseases, like the 2 big killers are TB for children and measles. But with fake news and people challenging truths, there are some people who are denying the efficacy of vaccines, which is not helpful. And misinformation is uploaded on social media. People need to take advice from trusted medical and nursing practitioners, who can guide them in the right direction. But globally, the good news is that TB incidence is falling at about 2% per year. It just needs to be accelerated to deliver on the SDG goal of ending the TB epidemic by 2030. It's been estimated that there's an annual TB World Report by the World Health Organization, and the latest report says that 54 million lives have been saved through TB diagnosis and treatment between 2000 and 2017. To be optimistic. Unlike HIV, it is curable. I mean, that's fantastically optimistic in terms of an infectious disease. So the earlier people are diagnosed and get on treatment, the better. And it means they're less infectious to other people, as well as they're protecting their own health. So through social media, through mass media, through ministries of health, probably there needs to be a resurgence in education in Ireland on TB and the 6 childhood vaccine preventable diseases. And then this needs to be rolled out globally in the countries where it's still a problem and people have a fear that if they're coughing up blood, it could be cancer, it could be witchcraft, or bad omen on the family, and they'd rather go into hiding than get diagnosed and start on treatment. And it's boring for people to stay on medication, so people do need support to be able to stick with it and comply with the treatment. In India, with our EU-funded program there, the concern was facilitating, was also linked with HIV. People had what they call TB buddies. A friend or a neighbour would support a person to go to get their medication every month so that they complied with the treatment. That can make a huge difference.
What did you say a minute ago there? It's very boring to be on treatment?
But for anybody on treatment, they have to go back to the health centre, maybe living far away, transport costs for poor people in urban areas or in remote rural areas. They need encouragement. And when people are not sick and when they're tired and lack motivation, that's where the depression comes in. And if they feel stigmatised, they think, oh, well, why would I bother going back for my treatment regime next month? So it really is important that people are supported, especially for the effective short course treatment. That people need psychosocial support, counselling. Again, very like TB.
HIV.
Very like HIV. World TB Day is the 24th of March every year. So I don't hear much about World TB Day in Ireland on the 24th of March. Maybe it should be a day that our minister and the HSE and the Ministry of Health in Ireland talk about it at least once a year to support people to understand the importance of prevention through vaccination, and if somebody becomes infected, that they stay on treatment. A number of my colleagues in Cambodia at the time contracted TB, because it was a particularly virulent bacteria. But luckily, they were able to go back to their home countries and get on treatment in Europe or back in Ireland here. But that's not so easy for people in very poor countries. And if the breadwinner or the head of household gets ill, well, the whole family suffers. So a father might not want to be found out that he's been diagnosed with TB. Again, a bit like HIV medications. I've seen people keep their TB medications hidden. They don't want to tell their neighbours if they're on TB medication.
So you're saying, do all children in Ireland get the 6 vaccines around the time they're born? Or are there some parents who refuse to let them have the vaccine?
Well, a small number, I believe, but both in the USA and some countries, some people are refusing vaccination. And that affects other people in the community, especially poorer people or people who have other sicknesses, because vaccines give what's called herd immunity. If, say, 80 or 90% of the people in the community are vaccinated against TB, other people are protected. So it's quite selfish not to accept trusted vaccines to protect your child, because you're not only affecting your own family and children, you also can be unintentionally affecting other children, or maybe a child with cystic fibrosis or some other, lung illness that already has weakened their immune system. No, I just would hope that through Near FM and education and marking World TB Day on the 24th of March, but like I say, for people living with TB or on treatment for TB, it's TB Day every day. And maybe the Mater Hospital where I trained, St. James's Hospital where I last worked also, if people would bring out more messages through social media from trusted sources, that maybe more people be inclined to pick up the vaccines and make sure that children are vaccinated here in Ireland. And then through Concern and Irish Aid funded programs in Africa and Asia, we can support the global response to end the TB epidemic by 2030. Thanks for your interest, Darren, and have a good weekend.
I have a good time in Bangladesh. I hope you do anyway. So I'll be talking to you again, Breda. Thanks very much, right?
Thanks very much, Darren.